Chiro is really good with massage and physiotherapy because our major focus is on restoring normal. Recent research is the neuroplastic model, which is essentially talking about
how do you tailor your treatments to cater those needs?
So the good thing is everyone's got a spine, everyone's got a nervous system, right? We don't have to change.
How does it feel to be listed on ThreeBestRated and called the best in the business?
Oh, look, obviously it's great to be recognised for the work that you do. We love being...
So, Dr. Brendan, how does chiropractic care complement other treatments like physiotherapy or massage therapy?
So chiro is really good with massage and physiotherapy because our major focus is on restoring normal spinal or joint movements, which then floods the brain with information about what's going on in the body, and that can allow the brain to therefore provide better feedback down and allow that area to move, function better. When it comes to physio and massage, obviously they're really good with helping with muscles, trigger points, strength issues and those type of things caused by the structural muscle. So when we combine neurological and structural issues, that's when we find we get the best results.
Awesome. Have you noticed any emerging chiropractic trends or advancements that you'd like to highlight for us?
I guess the biggest thing that I've seen when it comes to the research, the most recent research is the neuroplastic model, which is essentially talking about how the brain rewires itself when it comes to things like chronic pain over a long time. The brain changes its structure and the way it functions to deal with chronic pain. And when we approach pain from a brain model as opposed to you've got a knee issue model because you've got knee pain, then that's actually showing that we're getting better results for our patients and they're getting better longer term outcomes as well.
And are there simple daily habits that people that work desk jobs can adopt in their life to help maintain their spinal health?
Absolutely. Keep that spine moving. If you're sitting like this all day, looking at how you're three best rated, you're going to get that forward head posture, that slouchy position. If you can sit upright, even every now and then just do a stretch, go into that full bended and backwards position, that's going to create movement through the body and through the spine, and therefore remind the brain what's going on and stop that ligament to creep or that stretching of the ligaments in the wrong direction from being a permanent issue and reset that.
Lovely. And for someone that's experiencing chronic pain, when is a good time for them to come see a chiropractor?
As soon as possible, right? So chronic pain's already been there for 3 months, at least. That's when we start to rewire the brain into these maladaptive processes. So it actually gets worse. The brain reinforces these negative feedbacks that it's getting, and it can make you more sensitive to pain. So if we can get in sooner, it's a lot easier to change these types of things and undo that processes that have developed over time, and we'll get results quicker and longer term.
And what are some key factors that have contributed to your success as a chiropractor?
Look, I've had some really good role models and teachers over my time. I've done a lot of different courses, I suppose. So I've got a lot of different approaches to chiropractic, to how to assess and how to adjust different areas of the body. And I just put it down to, look, if you do what successful and really well-respected chiropractors are doing, then you're probably going to get similar results, right? Don't try and reinvent the wheel, just do what works. And that's why we get great results with our patients, because I don't spend time worrying about things that don't tend to get the best results. We just focus on what works and do that really well.
And what was your vision exactly behind founding Summerland Health in these communities?
So the vision's always been to allow people to live their life the way they want. We found that obviously in Port Macquarie, it's a bit of an older population. These people are wanting to get around, they're looking for longevity, they want to be able to be as independent as possible for as long as possible. So we're just trying to restore normal movement in the body, improve that brain-body connection, improve balance, mobility, all that type of stuff, so that they do what they want for as long as they want. And we just want to see happy people moving around doing what they want, because hanging out with cranky people all day is not very fun.
And we've noticed that Summerland Health offers services ranging from paediatric care into sports chiropractic.
Mm-hmm.
How do you tailor your treatments to cater those needs?
So the good thing is everyone's got a spine, everyone's got a nervous system, right? We don't have to change our approach to care massively. With pediatric care, obviously the younger they are, the different milestones they need to meet, the different structures of their spine, and we're obviously more gentle. We do more mobilization type things as opposed to the cracking, crunching manipulations. When it comes to even things like sports people or elderly people, there's not a great range of change that we need to make, because our end goal is to make everyone function as well as possible. Elderly people might just be looking to be able to pick up the grandkid. Athletes might need to tweak just that little 1% to get on top of their game type thing. But either way, the nervous system needs to be functioning as well as it can.
And lastly, how does it feel to be listed on 3Best Rated and called the best in the business?
Oh, look, obviously it's great to be recognised for the work that you do. We love being recognised as some of the best in Port Macquarie, so we're really happy that our efforts are paying off and being acknowledged.